There are indeed patients in a neurologically emergency state. In such cases, procedures are meaningless. Yes, I am Kyung-hoon Yang, the Director of Neurosurgery at 21st Century Hospital.
Hello, I am Jae Sung-bae, the Director of Neurology at 21st Century Hospital.
Today's topic is Let Us Explore. Is this surgery or a procedure?
There are patients from the provinces who don't recover or have poor outcomes. They come up here, but they say they have undergone a procedure. They come with symptoms like persistent pain or paralysis. Our understanding of a procedure is one that doesn't involve a scalpel. There are incision marks, meaning a scalpel was used on the back or waist.
Are there really many such cases?
Many people ask about the differences between surgery and procedures. To help patients understand, surgery involves anatomical alterations to the body and is a treatment method that removes certain lesions. A procedure aims to alleviate symptoms without altering the body's structure. We often distinguish between surgical and non-surgical treatments. So, typically, treatments that directly remove lesions from the body are classified as surgery. That is, maintaining the body's structure while using medication or other methods. We refer to procedures as popular treatments that alleviate the patient's symptoms. So ultimately, the goal is to improve, to cure the disease. Now, surgery is increasingly perceived as a direct approach to the cause, a shortcut, as it is often considered, if you will, whereas a procedure might take a longer route to alleviate symptoms. We often explain non-surgical treatments as procedures that can treat the disease without altering the body's structure.
I wonder why the terms procedure and surgery are used so interchangeably in the Korean medical market. I think it's because private insurance companies started intervening in the medical market. For example, it's like this. When there's an issue like coronary artery stenosis, a stent is actually closer to a procedure. In the same way, if the coronary artery is blocked and a stent doesn't work, surgery might be necessary. The coronary artery bypass, known as a bypass, is a very major surgery. These two are completely different treatments. But there were debates among insurance companies about whether to recognize it as a procedure or a surgery. So from that time, even doctors started using the terms procedure and surgery in a somewhat corrupted way. Because the term procedure itself might make the general public think of it as something lighter, even though it's the same treatment. Doctors also started confusing the terms procedure and surgery from the perspective that they could approach it lightly. These bad practices have somewhat infiltrated the Korean market. In any case, surgery requires the destruction of anatomical structures because you need to alter the anatomical structure to remove the cause of the disease. Whether you use a microscope, an endoscope, or a laser, or whatever you use, I believe it should all ultimately be classified as surgery.
The treatment area referred to as procedure can be considered as all other treatments besides surgery. The most common ones include taking medication and physical therapy, and the most widely practiced is nerve block therapy. Manual therapy and acupuncture in traditional Korean medicine clinics are non-surgical procedures, and a treatment that is gaining significant attention is the procedure known as neuroplasty. It is a method that approaches the lesion most directly to maximize the therapeutic effect of medication. For those who did not achieve therapeutic effects from previous procedures, they are achieving significant therapeutic effects through such neuroplasty procedures.
The criteria for when to perform a procedure or surgery.
There are only about 2 cases where surgery is necessary for spinal issues from a neurosurgical perspective. One is when there is paralysis, for example, if a disc ruptures and compresses a nerve, it causes not only pain, then the strength to lift or push the ankle becomes paralyzed, and the strength decreases. Additionally, there may be issues with urination or defecation, such as cauda equina syndrome. There are definitely patients in these neurologically emergency situations. In many situations, such cases, procedures are without any significant value or purpose, and surgery is recommended. Secondly, even if there is no paralysis or similar issues, if extreme pain prevents daily activities or if other procedures besides surgery have been tried for at least about 6 weeks without improvement and cannot return to daily life, there are such people. In such cases, surgery should be considered. I think it can be summarized into just those 2 cases.
There are hospitals that focus on procedures, It's not that they focus on procedures, but they can only perform procedures, so they only do procedures